Bore pawb. Such a pleasure to be here today, and the title of this conference really fits entirely with my raison d'etre and the raison d'etre of the organisation that I work for, which is the Parent Infant Foundation. It's a UK-wide organisation, and its primary goal is to promote the importance of parent-infant relationships, support the development of specialist parent-infant teams, and put baby's rights, baby perspective, baby voice at the centre of policy and service development. I'm a consultant clinical psychologist by background. I worked for over 20 years as the joint head of child psychology for an Iron Bevan, so obviously working in a very acute CAMHS environment. And I've always, along with my colleagues, tried to shift the dial and look at prevention and early intervention. And for any of you who work in more acute contexts, you'll understand that that is incredibly difficult to do, particularly as demands on services are increasing, as we've heard this morning. But I was very fortunate that I was in a context that supported that as far as we could. And then I was even more fortunate to join the Together for Children and Young People group, who led on the development of the Neath Nest framework, which we'll be hearing more from Millie about later. And again, that really puts the emotional well-being of babies, children and young people and their families at the heart of the whole system, which feels very exciting. And then I retired and thought I'd put my feet up, and the job got advertised with the Parent Infant Foundation as Wales Development Lead. And really, I couldn't not take that job. And I tried to look for that meme of the little girl who's got a very excited face, just to show how excited I was about being able to focus on the first 1,000 days in a early intervention, prevention and intervention for those families that are struggling the most. And then remembered that I've actually got my own face doing exactly pulling exactly that look of excitement. Here I am with my brothers and a guest appearance from my auntie's collar, which completely dates me, I'm afraid. But I think when you've worked in children's mental health services for as long as I have, to be able to focus entirely on this stage is really, really exciting. So one of the questions that gets asked is, what is infant mental health? And it's a very controversial term, as I'm sure you can imagine. But what the Foundation has done is try to kind of describe it or define it. So it describes a baby's capacity to experience, regulate and express emotions and form close and secure relationships. And of course, they can only do that in the context of relationships. Now, again, as a psychologist working in mental health, I would say that that is relevant throughout the lifespan, but it's absolutely pivotal for babies. And of course, each baby brings its own temperament, personality, experiences to that, but it's the relationships that offer us the biggest opportunity for supporting that baby to be able to understand their own emotional world, regulate their emotions and build that template for future mental health and well-being that we've heard about today. So what surrounds us shapes us. We've heard about that already. What is it that's changing the landscape of mental health, both for the positive and the negative? And what have we got? And it's fantastic to be in a public health context. What have we got that we can influence this and pinpoint the things that make the biggest difference? And I guess they're multiple. And what we also know is that this period in a baby's life is when we've got the most opportunity. Oh gosh, I'm flicking all over the place here. Where's that gone? Okay. Right. Brain development. Sorry, I can't go backwards. Is there a... Oh, there we are. Thank you. So the first 1,000 days, as we've termed it in Wales, the baby's brain is most susceptible to environmental influences. and that's both positive and negative. So it's that double whammy, if you like, that on the one hand we can prevent difficulties, but on the other hand we can enhance opportunities as well, which feels really, really important. And we know that this is the time that we can make the biggest difference. So the brain's ability to respond is at a peak period. So investment now pays off in ways that, of course, we can always make a difference later down the line, but it takes much more in order to make that difference. And why do we need to do it? Well, we know, and there's a huge amount of evidence supporting this, that those early years impact the rest of children's lives throughout childhood and into adulthood, impacting this whole range of factors. So it's how we can capture the impact of this in a way that everybody kind of recognises it benefits the whole of society throughout the life trajectory that feels very important for us to be able to do. And there's the kind of the moral and the developmental imperative, but there's also the financial imperative that we know that investing now makes the biggest difference throughout the lifespan. And the evidence is there. We've got 50 years worth of evidence, and I'm always a bit puzzled about why we're still having this conversation when it's so striking. And of course, it's all to do with the demands of acute need, I suppose, that makes it really hard for us to kind of shift and stop and pay attention to this. And for anybody who's looking for a really good summary of the evidence, then this from Harvard is a kind of really excellent place to see it all in one place. So the foundations for flourishing are laid by strong social and emotional skills, all of which have their roots in early childhood, but continue to develop them throughout our lives as we encounter new situations and experiences. And, it feels really exciting that the Royal Foundation are promoting this now. We've got, the Princess of Wales on our side, which feels like an opportunity to grasp. And the penny has really dropped for her that this is where the focus needs to be. So what is it that we need to do? I suppose we know about the why. What is it that we need to focus on? So this is the AAA of parent-infant interactions, and attunement is really at the key of this. So some of you will have heard the term serve and return, that idea that we take the lead from the baby and we attune to the baby's needs. And this supports all aspects of a child's development and well-being. And of course, adversity, we've heard about the adverse childhood experiences, and it's particularly important during this period of brain development, the impact that these can have. They can hinder a child's development and well-being, but also absence. And we've heard about phone use and parents being distracted and not focusing in on their baby's needs, which can inhibit a child's development and well-being. So what do we mean by attuned interactions? Children need attunement to feel secure and to develop well, and throughout our lives we need attunement to feel close and connected. We know this, it's really key, but what is it and how do we do it? Well, of course we do it through nurturing relationships for babies, but how do we do that? We support nurturing relationships with parents. And I guess the role of the Parent-Infant Foundation and lots of people working in this field is really to help the penny drop, that whilst we understand this for adverse childhood experiences and poverty, we need to understand that parent-infant relationships are really central to this. And I guess from my perspective, as I mentioned before, it's really a fantastic opportunity because the solution is in the problem. This isn't about doing anything very different other than supporting parents and the wider network around babies to do what they all have the potential to do. So it feels like a really exciting opportunity. So when my role, as I say, came about, I was thrilled. And I worked 3 days a week across Wales. So it was really important for me to try and focus and make sure that I wasn't getting too kind of tied into one area, but to have that whole system approach that we're going to hear about a bit later. So to pay attention to national policy, and it was fantastic to hear Sarah Murphy talking earlier to what's going on regionally and working very close with Millie and the partnership boards around developing this area, and then getting to know colleagues at a service delivery level. And as with many services, I think there's a lot of amazing practice that has kind of grown up around passionate individuals. And sometimes I describe my job as kind of hunting out like-minded people. And that the more you look, the more there are people who are kind of in spite of their job doing this, which feels very exciting. And then parent-infant co-production. We've heard again about co-production and babies' perspectives, and just how concerning it is, I suppose, that babies are most vulnerable in society, and yet their rights really are not at the forefront of our thinking, even amongst children's rights. We heard from Sarah Murphy about the 400 children and young people who'd responded to the consultation document. A baby can't respond to a consultation document. What we did do in order to try and address that and shift the thinking a bit was to develop a baby response based on a collection of perspectives from professionals, parents and children and young people who put themselves in the shoes of babies and responded as if. But we need to work very, very hard at making sure babies' voices are included in how we're thinking about service delivery. So this is my niece. This was when she was 4 weeks old. And what's fantastic is that she's on the first 1,000 days journey as I'm on the first 1,000 days journey of my 3-year role. So I find that really helpful, actually. I asked her parents for permission to use this photograph, and then it dawned on me as I was putting these slides together that I hadn't asked her. And of course I can't ask her, and she can't give consent. But what I could do was go back to her parents and say, what do you think Ellie would think about me using this? And these are the reasons I'm using it. And to ask the question in a different way that recognised that Ellie had a perspective, and that perspective was different to my perspective and that perspective of her parents, and that it will be my responsibility to revisit that with her as she grows, and to check that we were right in guessing that if it was about supporting babies like her, then she would be wanting to be involved in that. So looking at small ways to amplify babies' voices in order to make a difference feels really important. We've heard about the mental health and wellbeing strategy. We're very excited to hear what that means to babies, and it was great to hear Sarah Murphy talking about that earlier, and the delivery plans. So things are starting to shift. And we've also written the Golden Thread document, which really kind of focuses on why parent-infant relationships read through all of our services, that any of us delivering input to families during this phase of life are going to have the biggest impact if they do that through relationships and focus through relationships. So really ensuring that the Golden Thread of relationships weaves through everything that we do, and bringing all of our collective energy to that. And this diagram just really kind of shows that we need to shift away from thinking whose job is it and putting the needs at the centre of everything that we do. So in a way, specialist parent-infant teams could and do throughout the UK sit in all sorts of settings, and they're relevant to all sorts of settings, and to carve them off into one area of service delivery misses the point about the whole system approach. But the risk of that is that no one service or agency or profession takes the lead. And I think that's why we're so behind in thinking about babies. So how you get the balance of, on the one hand, developing things and the way that things develop in our systems, versus the absolute vital importance of recognising that whole system approach, and that it's all rooted in community, and that health, public health, third sector, local authorities all have a role to play. So what do we do? Well, I'm going to try and play the clip now, and hopefully it'll work, because it's not rocket science.
Okay. They need to work on that, right? Yes, okay. Did you understand it though? No. Okay. All right. Huh? Oh, no, not this one. This is the grand finale of this. Yeah, that's the last one. That's what I was wondering. I don't know what they're gonna do next season, because they did some stuff this time. Exactly what I was thinking. Oh yeah. Right, don't bring that again. You know what I'm saying? Don't do the same stuff. You know what I'm saying? Yeah, I was like that. Yeah. Yeah. Like go somewhere else with that, but don't bring it here. You know what I'm saying? Yeah. That's what I said. And then it was like, you know what I'm saying? And I was like, what in the world? But don't do it here. You know what I'm saying? Yeah. Yeah. Really? I thought the same thing. We think a lot alike, huh? Oh, that's crazy. Right.
Oh, can move it on. Thank you. So, just an example there of a baby who doesn't have language yet, but is communicating and making their voice very heard, but particularly a dad who's completely tuned into that baby, and that serve and return so beautifully demonstrated there, and that baby who feels safe, secure, heard, and like he has a say in his world as well. So it's just a great example, and it demonstrates that it's not rocket science. It's about slowing down and letting babies lead us in how we think and how we respond to them. But it's quite self-conscious making sometimes, and it's quite difficult in the context of professional lives, I guess, to put ourselves in the shoes of babies. And so just to get over, oops, it's gone again, sorry, I don't know. Thank you. Just to get over that self-consciousness, I'm going to split the room in two down this table here, and we're going to have a left side and a right side. And if this is hard for you, imagine how it is for me. But we're going to sing that serve and return, Twinkle, Twinkle, Little Star, to each other. Okay, so over here first. Twinkle, twinkle, little star, how I wonder what you are. Up above the sky so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. There, phew, we've done it. And I suppose the point is that, we've got to let go of our inhibitions and kind of respond to babies as they want us and need us to respond to them. And they don't care if we're in tune or if we're singing the right words. It really is about kind of tuning into their needs. I was recently at an event in Cambridge when a professor from Harvard came and talked about kind of how you can support what development needs in very resource-poor communities. And he was talking about some research that had happened in very kind of poor Chinese farming communities. And he did some studies of a farming community that had become a fostering community. And the children who came with very significant needs, babies and children who came with very significant developmental needs to that community, just absolutely thrived. And he showed a clip that I couldn't kind of get, but it's on the website, but I couldn't kind of transfer it for obvious reasons probably, of this in practice. But what the research kind of extracted were connection, reciprocity, that serve and return, inclusion, that sense of belonging, and opportunities to grow. Key things that actually supported children's development. And that, in a way, things like curriculum and expertise and training, all of those things, of course, enhanced to some degree, but without these core elements, then children don't thrive in the same way. And I just thought that was such a powerful kind of bit of research to kind of recognise and shift what we're focusing on in order to enhance babies' opportunities. And I guess this is a slide. I'm married to an engineer, and we don't often kind of connect in terms of our professional worlds. But he was sharing a talk he was giving, and he talked about turning the tanker in his engineering world. I can't even remember what it was about now. But I really liked the concept that instead of trying to turn the tanker, which can feel a bit overwhelming, and where do we start when in such a complex kind of world, but he talked about the flotilla, you know, and each ship turning towards that kind of bigger picture to make it less kind of daunting, really. So I'm hoping that, you know, lots and lots of what we're going to be hearing today, and certainly haven't been at the conference in Cardiff, that the equivalent of this conference in Cardiff, there are so many connecting themes in our work, and we'll hear about the NIF-NEST framework, the whole school approach, and then some real live examples of it working in practice. The tanker is starting to turn, or the flotilla rather, is starting to turn. And there's my niece last summer alongside this journey, and I'm really excited by, you know, what after the first 1,000 days in this role, we will be thinking about parent-infant relationships. And then just finishing with, you know, I've got a floppy disk with It Takes a Village. We've said it so often, and I believe in it passionately, but we need to, you know, recognise it's not the penny, that the penny hasn't quite dropped if we're still talking about it now. So I found another African proverb that I really like. If you want to go fast, go alone. If you want to go far, go together. There we go. And do get in touch. I'd love to make contact with anybody who's interested to hear more. Thank you.